When Children's Cancer Cause held its patient-focused drug development conference on hearing loss a few years ago, we heard many stories from survivors about the challenges they faced with the loss of hearing as a result of their treatment. And I know that you've described chemotherapy-induced hearing loss as one of the underappreciated side effects that pediatric cancer patients face. Could you maybe share a little bit about what you mean by that?
Yes, of course. And that meeting was incredibly moving and impactful for me. And I'll just say that a lot of the things that I heard from families and participants in that meeting are things that patients have said to me as well. And but it was incredibly powerful. So in terms of hearing loss research, we do have an increasing body of evidence about hearing loss and the risk factors related to hearing loss in childhood cancer survivors. And we have some very good data that's come out over the past few years, especially from the Netherlands and elsewhere, to really drill down on the risk factors for hearing loss. But from my perspective, when I say underappreciated, what I mean is that I think hearing loss is not just under-researched or poorly understood, but that as a society, we do not appreciate how impactful hearing is. And hearing loss and all of the difficulties associated with hearing loss have been relatively ignored. And we know that during treatment, and we heard this at your meeting, during treatment, parents are told your child will have some hearing loss, but they can get hearing aids. And we know now that saying something like that, even though that clearly reflects the fact that you're delivering life-saving treatment, and in many cases you have no choice but to use those treatments, but just saying, well, your child can get hearing aids really does not describe the experience of hearing loss for childhood cancer survivors. And as a society, we've made hearing aids expensive, unavailable, uncomfortable, difficult to access, and we've made it very difficult for people to get accommodations in school or work. So that's why I say underappreciated, because I feel like there's so much more to it than just understanding the prevalence.
Yeah, and can you share from your own patients as well as those you heard from at the meeting, like what does the issue of hearing loss mean on a daily basis to someone who's undergoing that?
Sure. So a few years ago, we published on our experience of hearing loss with a qualitative study that came out in Cancer. And in that study, we interviewed adult survivors of childhood cancer in our clinical program who had hearing loss. And the reason we did that study is because we had an earlier study where we were looking at audiograms, and we found that 50% of our patients with profound hearing loss were not using hearing aids. And I found that very shocking. And I thought that survivors would tell us, I'm not wearing hearing aids because they're too expensive or they're uncomfortable. Because I certainly knew of patients who got hearing aids and then didn't like wearing them for various reasons. But actually, we did hear those things. And it's true that hearing aids are not easy to get and they're very expensive. And also there's this terrible disconnection between the person who does the testing and the person who fits your hearing aid. And sometimes those people are in the same place and sometimes they're not. So I kind of already knew about some of those issues, but actually what we learned was also that for adults who've had childhood cancer, they have so many things on their plate. And to be honest, this has probably been worsened by the challenges of COVID and all the difficulties people are facing these days. But they have so many things on their plate, including so many medical things, that hearing loss was deprioritized. So survivors said, well, I have to get a mammogram and I have to get a scan and I have to get my blood work and I have to see this other provider, and I also have to go to the school counseling center because they're not following my IEP. And so getting to a series of appointments for testing and then fitting and then refitting and replacement and all of that to get to deal with hearing loss, it just was too much. So they just could not prioritize it. And that was something actually that we learned is not the case, or has not been described in other populations with hearing loss. So it seems pretty unique to our survivors.
And when you look ahead, in terms of the research that's being done to, treat or prevent hearing loss, what do you think what does the future hold, and what kind of research do you think needs to happen in this area?
I love this question when it comes to hearing loss, because I think you can look at hearing loss at every level and at every moment in the cancer continuum. So you have the level of the individual, the level of the community, the level of the healthcare organization, the level of society. And then you have the continuum, which is we need better detection, and we're funding, NIH is funding research on technologies to improve detection. So for example, if you had bedside testing which was as good as a PhD performed audiology testing, where you could have a bedside test while you're delivering the cisplatin or within moments of delivering the cisplatin, where you could test the hearing aid right at the bedside, test the hearing right at the bedside. How many more children would have access to hearing testing if it could be done at the bedside? So we are funding technology to be able to do bedside audiology. So that's one, detection. Then you have prevention. So could there be a treatment for cancer that does not include platinum agents or radiation to the cochlea? Now that's not work that's funded by the Office of Cancer Survivorship, but that is very active work that's being funded by NCI and elsewhere at NIH. Then you have prevention in terms of a drug like sodium thiosulfate that can remove cisplatin from the body and prevent hearing loss by not allowing the cisplatin to linger. And we know that there's some evidence that that's effective, but we need more, and we need different agents besides just sodium thiosulfate. And we know that it can't be used and it doesn't work in certain settings. So it's not going to be the answer for every situation. And so we need other drugs. And there are some that are currently being tested that can be given concurrently with chemotherapy or with radiation therapy to prevent hearing loss. Then we need better understanding of individual susceptibility to hearing loss. So we know that two children who get the same doses don't necessarily have the same late effects. And that's clearly true with hearing loss as well. So what makes one child more susceptible to hearing loss than another? And that's actually some work that's being funded by the Human Genome Research Institute. So we have on an NIH level, people working on individual susceptibility. Okay, I already talked about detection. Then rehab. So what is hearing rehab? We're actually funding work on hearing rehab, which is pretty cool. And of course, treatment. So there is a whole institute, NIDCD, which is Deafness and Communication Disorders. And they are funding some very interesting work on what's called nanodialysis, where you can actually take a tiny device and put it into the ear and insert a chemical that extracts the cisplatin from the inner ear. And that is treatment for the lingering cisplatin that could actually occur years after you've delivered. So we know that cisplatin is still there, so let's get it out of there. Let's keep it from causing ongoing damages. And then also all of the work that needs to be done to address the consequences of hearing loss. So what needs to happen in our educational system, what needs to happen in terms of better treatment, in terms of better technology for hearing aids or other assistive devices. I mean, so it kind of touches every moment of the cancer continuum, as I said, and also every level of the human experience.
Yeah, and I mean, what you've described is some pretty cutting edge research, as well as, looking at, as you say, all along the continuum. I guess as an advocacy organization and, representing the patient community, how do you think that we as a, collective advocacy community can really help to amplify this issue and amplify the voice of the patient so that, we can contribute to a better quality of life for those with hearing loss?
Well, we need more awareness. I do think this is not just a problem for survivors, but a problem in our society in general. As I said, when it comes to hearing loss, it is an underappreciated problem, and we do need more awareness. I think we also need support for investigators who are interested in this topic. And those could be, I think this is one of the beautiful things about survivorship research is that we have so many different kinds of investigators. But it does make it difficult because we're all in different places and doing different kinds of work. But we got to find ways to support investigators who are interested in hearing loss. And the other thing, and this is something I thought of specifically, is that we need diversity in our participation in studies. And one of the ways that we have suffered as a field is that we often are not including in our studies the populations that are most impacted by disparities. And so we need better ways to connect people who are experiencing hardship to investigators who are interested in helping with those problems.
Well, Emily, I just, wanted to thank you for all the work that you're doing in this area and all of the great things that are to come from this work, and, really sort of rallying your center and your area behind this. So thanks for that, and thanks for being on Conversations here today. We really enjoyed having you.
It's my pleasure, and I'm very glad to be part of the work that you're doing on behalf of childhood cancer survivors.
Great, as are we. Thank you.